Welcome to the MRO Exchange, Connecting Healthcare Executives, your go-to podcast for staying informed in the dynamic healthcare world, where MRO discusses industry trends and topics with prominent healthcare leaders. In each episode, we delve into the intricate landscape of the U.S. healthcare system, shining a light on the immense responsibility shouldered by providers to effectively acquire, manage, and share clinical data with data consumers. Join MRO experts and healthcare executives as they navigate the important dynamics within this highly complex environment. From the surge in healthcare ecosystem demands to the influx of structured and unstructured data scattered across diverse systems, along with the ever-growing compliance, security, and privacy expectations, the MRO Exchange, Connecting Healthcare Executives, unravels it all for you. Tune in for a comprehensive exploration of the pressing issues shaping the healthcare industry today.
Hey everybody, I'm Matt Wildman, Chief Commercial Officer at MRO. Thanks again for tuning in to the Exchange, where we spend time connecting with healthcare execs from across the industry to explore their journey and perspectives on relevant topics that we think leaders are facing and working through every single day. Today, I'm joined by Christopher Kunney, Managing Partner of IoTech Consulting. We're going to dig in a little bit to the topic of payers' direct access into their provider network EHRs. So Christopher is a highly respected healthcare technology thought leader and strategist. He collaborates with health systems and ACOs, government agencies, and all different types of provider organizations to provide guidance and insights on emerging healthcare technology offerings, compliance-related issues, and technology adoption. He's held senior leadership and C-level roles at companies like Divergent, Juno Health, Coker Group. He was the CIO at Piedmont Healthcare. He's an author of numerous articles and books. HIMSS recognized him earlier this year with their Changemaker Award, which I think is so cool. He hosts his own podcast called Straight Outta Health IT. And I'll tell you, he's just an all-around awesome guy. So Christopher, I'm delighted to be with you today. Thanks so much for joining us.
Thank you. Thank you so much. It's such a pleasure to be here. I'm excited to have the conversation with you, Matt. And there are two things I wanted to add to that intro. One, I'm not an author of a book yet, although I'm working on one.
I was giving you credit.
Well, hey, I appreciate you projecting that in the future for me. And then the other one is I'm a grandpa. I was recently, as of this week, I became a part of that amazing fraternity of grandparents as well too. So that's probably one of my greatest accomplishments as well too. So excited to join that group. Yes.
But maybe before we jump in, Christopher, I'd love for you just to share a little bit about your journey.
Sure.
You've been on in healthcare, and maybe if you're comfortable with it, like why you're so passionate about changing healthcare is delivered today, and just give us a little flavor of you.
No, absolutely. Well, thank you again. My background is going to be dating myself. Obviously, I'm a granddad, so I've been around a while. I started in technology in the late 80s, as a matter of fact. My degree's in computer science and mathematics. I was a software developer in the late 80s. Working, interesting enough, for a company I didn't realize at the time, but I was working in healthcare back then for a company called Gerber Alley that ultimately got acquired by HBO, that got acquired by McKesson. And so we were developing financial software for healthcare back then. And I was a COBOL developer, if you can. I'm really dating myself as well too. And then I moved into roles in organizations like Hewlett Packard, where I was a systems engineer and a quality manager, and ultimately became an operations director there as well. And then towards the beginning of the first dot-com bubble, worked for a company that was developing, we called it cloud now. Back then, we called it ASPs, application service providers. We were developing software in that space as well. I actually then bought a company where I was doing e-commerce development at the height of the whole dot-com bubble. I was a little late in the game because the bubble burst, recession hit, and I ended up having to go find a real job. So I ended up becoming an adjunct professor and teaching a wide variety of courses. One was in critical thinking and problem solving, and I was teaching the concepts of industry trends and looking at those trends and getting ahead of them and riding the momentum of trends. And I said, oh, by the way, there's this trend around healthcare technology that's happening. Students, you might want to think about getting involved in this. It's this thing called electronic health records that are emerging. You might want to think about, investing in that a career in that space. And so one day I was shaving and I was brushing my teeth, and I was like, "Wow, you're telling your students to do this. Why the heck aren't you looking at it?" We're preaching to the choir. And so I was fortunate enough to secure a job at a local hospital system here in Atlanta, where I live. And over a much longer story than I'll tell, I won't bore everyone with it at all, but ultimately throughout a period of promotions and growth opportunities, I eventually became CIO for the health system. And I think that really led me down the path of being kind of an executive and a thought leader and someone who was interested in truly transforming the industry. We were in the midst of implementing our own electronic health record system. We were getting into telehealth at that time. We were acquiring building a heart center, a women's center. So a lot of things were happening and were requiring more hospitals and more clinics at that time too. So cut my teeth on that and then moved to the dark side and became a consultant. Worked for a boutique consulting firm for a minute, and then got recruited by AT&T to help them launch their healthcare practice, which I did. And then had various companies reach out to me to help them do the same. So I launched my own consulting practice back then and started working with a wide variety of hospitals, physician practices, startups, emerging tech companies, and really taking advantage of the momentum around digital transformation that was happening in the space at that time. And you talked about a little bit why I got into healthcare. One, it was initially because of that trend. Two, because then of my parents, who both were dealing with health issues. My dad, unfortunately, died of a heart attack. My mom died of cancer. I myself went through challenges where I was diagnosed with not one, but two brain tumors. And so I had brain surgery myself. And then a whole host of issues with family members and loved ones who have had to go through the healthcare system. So healthcare touches everyone. I don't care what your socioeconomic backgrounds are. You can be a billionaire, or someone is, living day to day. And at some point, you're going to have to touch the healthcare system. And for my background of having worked outside of healthcare and going into healthcare and learning how we could leverage some of the best practices from in the industries, which we started to bring to bear, and then starting to see this momentum happening with the adoption of electronic health record systems, which led to all these other emerging technologies like telemedicine and now blockchain and AI and other things. And I'm a geek at heart. And so it's just exciting to see how technology is starting to truly help transform healthcare and creating systems that allow our clinicians to make better clinical decisions, our leaders to make better operational and business decisions, and then more importantly, patients to be more empowered in their own decisions around healthcare as well. No longer do we have to fully trust one individual's opinion about our diagnosis. We have access to resources that can make us, again, much more educated consumers and advocates for those we care for and love. And so I'm just very excited to be a part of this industry. And then, as I mentioned, I'm a grandfather now. I watched, the birth of my grandson, and then some challenges that they were having at his birth, and then the fact that they literally saved this child's life. And how can you not be a part of an industry that is saving people's lives and trying to do what you can to make that process of saving people's lives and the people that do that on a day-to-day basis, empowering them to do that much better, much smarter, much more efficient. So that's my story, and I'm sticking to it.
Gosh, you've pretty much done it all.
I've been around a while.
Yeah, the variety of experiences and the direction path is fascinating. That it's so true. I mean, it's personal. It touches us all.
Absolutely.
We serve an industry that provides a service that nobody really wants to consume. which is
Exactly.
interesting space to operate, but it's
That's right.
we're blessed.
But thank God it exists, right? That we have access to quality health care. We have our challenges and we still have issues in our system, but thank God we do have a quality access to quality health care in this country that we can take advantage of when there is a need.
Yeah, yeah, amen to that.
Yeah,
So let's talk about
sure.
some of those opportunities,
Hmm.
think differently or operate differently, if you will. And as you know, like at MRO, we kind of sit in this middle space in between this dual-sided network where we serve both the provider organizations
Right.
and payers in this pursuit to accelerate clinical data exchange on all sides. And what we continue to see is the demand for this exponentially growing kind of appetite for clinical information continue
Absolutely.
to grow. The providers that we serve are really struggling to keep pace with that demand. And as a result, we've seen payers start to advocate for direct access into those providers' EHRs.
Exactly.
And, and so it feels like a really kind of timely topic as we kind of sit here today. We've seen the number of data breaches increase every year over for the
Hmm.
last 8 years. We're certainly on pace for another year of growth in those breaches. We're on the heels of some major news events over the
Yes.
few months. And so I hosted this roundtable um, a, a month or so ago at HFMA, and we brought a group of 15 different health systems together just to learn from them kind of how they've approached this topic of to grant or not to grant direct access to their health plans into their
Hmm.
EMR. And it was just really interesting to listen to their stories and their thought processes around how they've made those decisions, whatever those decisions are. And I'll tell you, they're varied. And there's a lot of emotion on all sides
Yes.
of the equation. And so I'd love your perspective as a former
Sure.
CFO, as somebody who has done everything in healthcare. Uh, what what do you see as
Yeah.
potential benefits of direct access or perhaps the downsides?
Yeah, well, again, very loaded question, right? You have to kind of start with a little bit of the history and or dysfunctionalness that we have in our health system. There's been this kind of love-hate relationship between payers and providers, right? Payers are trying to figure out how to maximize the investments that they have and keep as much of those dollars in-house, and providers are trying to provide the best care possible. And as a result of that, that costs, money to do that. And so you have to send, a bill to someone who has to take care of the services that we deliver. And so there's always been this kind of contention between payers and providers. But I think also what we're starting to realize is that the power of the data now, the data is truly currency in the healthcare system. The fact that we now have the ability to collect patient information through the tools like an EHR, and then we have aggregation tools, AI reporting tools, data analytics platforms, et cetera, that allow us to take that data and create insights from it and knowledge from it that will help us be better at what we do in our various parts of the business, whether
Yep.
it's making better decisions about how we measure risk amongst patients, whether it's making better decisions around what type of care we deliver to patients, or the patient themselves making decisions about where do I go get care and how much of this care do I want to and what payers do I want to potentially use, as a part of that process as well too. And so there's all this, this contention for access to information. There's also a little bit of a concern that by providers, obviously, and I'm sure you've heard this when you talk to those, we don't want, these guys, in our backyard, knowing everything about what we do on a day-to-day basis, because they may use that to their advantage. And somehow that means we're going to not be able to provide the level of care that we want to because the payers are going to limit our ability to do that. And then payers are saying, well, we want to make sure you're not abusing these investments that in insurance, and so we want to try to hold you accountable for streamlining those processes as well. So it's an interesting journey and a very, it's at times contentious relationship between those two groups. But when you think about this term of clinical data exchange, which really refers to kind of the electronic sharing of relevant information across different systems that both providers and payers and stakeholders across need to make better decisions, we have to figure out and come to some term that that information is needed by all. Now, you don't have to have every component of it, of every aspect for your part of the business, but you do need that information that's relevant to your part of the business to be able to be a better clinician, a better provider of services, a better advocate, et cetera. And I think we're at the very beginning phases of our ability to take full, advantage of this information. And so we're going through this kind of growing pains around access to data and who truly owns the patient information. Ultimately, patient says it's my data, it's as I should own it. But also from a litigious standpoint, the providers feel like they need to be the legal owner of the record themselves because they're going to be held accountable for that patient's well-being. And then the payer is saying, I need to have enough information to be able to assess the risk associated with this so I can determine what's the real value of delivering, of reimbursing you for the services that are being offered. It's a long-winded answer to probably a shorter question that you asked. And I would say it's a very transformational time that we're going through right now, because now we have so much availability to get access to this data. The challenge before the electronic health record systems were it was all on paper. It was very difficult to aggregate that information in a timely manner. And it was very costly to do that. And sometimes it took a long period of time to get any reasonable insights, which may also mean that that data that you're looking at 6 months later really doesn't apply to what's happening today. And so digitizing this information has allowed us to get real-time insights into what's happening in this ecosystem. And I think everyone wants to know and know what's available to them, what insights I can garner for that. And the more data that's out there, the more insights I want to get. And so I'm not surprised that payers are going to want to get more insights on the information available, and providers will too, and so will patients. And we all have to figure out how to play in that same sandbox together, such that it's mutually beneficial for everyone.
Yeah, and as I've talked to providers about this and heard how they're kind of thinking about it, I think part of I'm providing this information, a subset of this information anyway. And so there's this promise of, does this allow me to reduce the administrative burden on my team, reduce the tax on our system to go comply with our obligation to share this clinical information?
Mm-hmm.
So the promise of administrative burden reduction is there. It seems like there's this fear of if I open up access to the entirety of the record, I subject myself to an increase of denial. And I'm just curious, in the conversations you've had, are you seeing either of those come to fruition, to the good or the bad, or is it just too early to tell?
I think it's a little bit too early to tell. And to also answer, yeah, I've seen it on both sides. I mean, the goal of being able to gain insights into this information is to help, from a payer perspective, the elimination of redundancy, right? Sharing this data can help you avoid unnecessary tests and procedures, and hopefully save time and reduce cost in healthcare. It can help streamline operations, on both ends. Mm-hmm. By retrieving that data and reducing some of that administrative burden that both the payers and the providers have. But also it can provide some level of accountability, to the equation. And that is, payers are going to say, why are you having to do duplicate tests, for a patient? Why can't you use a test that was previously done before? And so there is some valid questioning that they have around how healthcare is delivered today. Are there opportunities to streamline processes, to reduce redundancy, to find less expensive ways to deliver care? But also on the provider side, we want to make sure from a litigious standpoint and from a quality of care standpoint, we're, measuring twice and cutting once, right? If that means I have to, do multiple tests just to make sure that this patient's condition hasn't changed, maybe it's in that patient's best interest to do that. And so there are times where redundancy might make more sense than just to go, again, measure once and make a decision once. So it's an interesting dynamic we're in. And I think we'll always, to some degree, have this contentious relationship between how much data do I share, and then how much does the payer tell the provider how to deliver care, and how much does the provider say is held accountable for how they deliver care as well.
Yeah. And if I think about it from a payer's perspective, I talked to one recently who said, like, their perspective was, we don't really want to deny these claims. And in fact, we actually ultimately pay 65% of those that we denied when we get access to the appropriate information to support that reimbursement. So if we had access to that sooner, we could have avoided that exchange altogether. So totally
Sure.
your point earlier around some contentiousness that exists in the relationship structure, but I think as we think about this, it's important to really understand where both sides are coming from and
Right.
create a system that works in support of the needs of all. So
That's right. And let's not be naive too. There is abuse that happens in the system. There is insurance fraud that happens where there are providers there who have been bad actors who have, taken advantage of the nuances associated in this system, and they have, submitted false claims. And
yeah,
so, payers have to be sensitive to that as well too, and they have to make sure that, is this claim accurate? Is it, complete? Is it justifiable? Because I have to pay this money out, and ultimately, who bears the brunt of that? It is the employer who is providing that insurance to their employee, and the employee themselves, who has their own deductible and cost that's coming out of their own paycheck for that insurance as well too. So there is some accountability that the health system has to take on to ensure that, the procedures that are being reimbursed for, you can justify the reasons for them, because there are bad actors out there who are taking advantage of our insurance system.
so Christopher, let me ask a philosophical question. Like, do you
Sure.
feel like there needs to be guardrails in place for that govern what information a payer can look at if given direct access, and what should those be, if so?
You know, um, I think the short answer is yes. I think I don't think that the payer needs to have carte blanche to be able to see all the data that is, within the patient's record, that's not necessary for them to see in order to make a decision about whether or not this is a legitimate claim. And so they need to, the two groups need to collectively identify what are the key components that are needed in order to be able to justify the claim, and then to be then reimbursed for it as well. So yes, I think there should be those guardrails. Now, um, the providers have to also be sensitive that, the industry is evolving and changing, and what was normally considered patient information is now expanding beyond things like social determinants of health, for example, right? For this is other data that's kind of non-traditional, non-clinical data that is being collected to understand how that's impacting the patient health. That might be relevant for a provider to try to understand, the economic condition of a patient, whether there's food deserts, or, what their education status is, other things that might be determining their overall health, because they do have to factor in things that determine the risk associated with that patient, because we are paying, they're making decisions based on risk scores,
Yeah,
and now we're having to think about these other factors that maybe we haven't traditionally thought about, and so that may be information that is not necessarily traditional that they're now seeking, and maybe other pieces of information that maybe in the past was a little bit off limits to them, that's now relevant to understand true risk of a patient profile.
yeah, yeah. One of the things that's really been so foundational to our business is just this concept of minimally necessary. Like just
Mhm.
be outstanding at accelerating the flow of minimally necessary information to solve the for the use case at hand. And so as I've talked to providers around the country, that I think there is a wide variety of um, kind of thinking around those policies, procedures, processes
Mhm.
to manage minimally necessary kind of information sharing. And so, curious if you have a point of view on that from a IT perspective, like how to think about that in this clinical data exchange world.
Yeah, I think what you're starting to see, the government is really starting to push more of standards around interoperability and access to patient information for price transparency, for example. The Clinical Laboratory Price Transparency Act is kind of an example of one where you have to disclose healthcare cost, and that has to be made available through, effective data exchanging. And so there are situations where transparency of information is needed so that, again, you can hold organizations accountable. Are you charging a fair, price for your services? And I think also the patient as the consumer is demanding that as well. I want to be able to decide, is this the place I want to have my care delivered based on a number of factors? And that's, the quality of the delivery of care, maybe the location of the facility, but also the cost of the procedure that I'm going to be paying for. Healthcare is one of those few industries where it's still kind of nebulous in terms of what is it going to cost for a service, right? You go into a hospital, do you know when coming out, when you're going in, do you know how much you're actually going to pay before you go in and get the procedure? 9 times out of 10 is, they can give you a general estimate sometimes, but the reality of you don't really know what you're going to end up paying until the procedure is done.
Yeah.
And why? Some of that is purposely, quite honestly, purposely done. We don't necessarily want you to know all aspects of what the fees are going to be until at the end of the day. Some of it is just the nature of the business as well. You don't know if a person's going to need a certain medication or are they going to improve or are they going to turn for the worse or whatever. So you may have gone in with one idea, but ended up the person got an infection or something that required more care. And so, but the consumer again still wants to, as best as you can, give me some idea of what is it going to cost for these services. And so does the payer, because they have to also take into account from a business perspective, what's the risk associated with providing care for these individuals, and do I want to take that risk on?
Yeah. Look at you bringing it back to the patient and the patient.
It's always, yeah, at
Yeah.
the end of the day, right? It should always be about the patient, although sometimes I think we get so caught up in this industry is healthcare is acting more like traditional corporate America, and although I get it, no money, no mission, but ultimately it still is about the patient, and are we providing the best care for the patient possible at in the most cost effective way?
Yeah.
And we all play a role in that, the provider and how they deliver services, the payer and what they're willing to reimburse, and the patient themselves and their own accountability for their own health. You,
Yeah.
you can't expect to get cheap insurance if you are smoking and drinking and heavily drinking and doing other things that aren't really good for your health.
Yeah.
So there's accountability that we all own.
Yeah. And so, like, to keep it at the patient level, like, how do you see the benefits to them when payers and providers kind of collaborate better in this exchange of clinical information in a more accelerated form?
Yeah, yeah, exactly. I think it goes back again to transparency, right? Hopefully this leads to more transparent understanding of the cost of the delivery of care so that they can make better decisions around what options they have available to them ultimately. Hopefully it also holds providers accountable for delivering a high level of and quality of care as well too. And so having checks and balances around some of that, I think, is important. And then, patients can also make smarter decisions about what insurance options are available to them based on payers being able to compete in the open market for their customers. So I think it has a lot of advantages to the payer and slash consumer in being able to make the right selections in terms of the insurance that they have and the providers that they want to use.
Yeah, love that. Let's leave it there for today, Christopher. Really appreciate you being with us. Thanks so much for your insights and your participation. It's always an interesting conversation. For those listening, for more information on what MRO is doing to accelerate clinical data exchange and improve the information sharing between providers and payers, please go look at our website, mrocorp.com, morcorp.com. And Christopher, it's wonderful to be with you today. Thanks so much.
Thanks for being here.
Thanks, everybody. Have a
Thank
great
you.
You've been listening to the MRO Exchange, where we connect healthcare execs. For more insights and to hear other healthcare executives' exchanges, visit the show's page on mrocorp.com and be sure to explore additional resources and thought leadership articles. You can also check out the program page on healthcarenowradio.com. Finally, be sure to connect with us on LinkedIn or X at MRO Corp. Until we talk again, this is the MRO Exchange, where healthcare execs connect.